and Happy New Year, and welcome to iTenif Healthcare Solutions webinar, the 5.9 8.4 Upgrade Experience, Lessons Learned from an Early Adoption. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for iTenif. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of the slides and recording within the next week. Next, for those of you who aren't familiar with iTenif, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. And we also have two add-on productivity solutions for NextGen, ChartGuard and Refund Manager. Next, I want to mention an upcoming webinar, Opening the Door to Closing the Order Loop in NextGen, 2 weeks from today. Join us to learn about the added functionality in NextGen that allows end users a more efficient way to close the loop on outstanding orders that lack an interface. Clinicians and office staff can now confirm results we received through both document management and the provider approval queue. We'll walk you through this new and improved process of closing the loop for both applications that now allow the results to be reviewed and linked to the order. We plan to emphasize the importance of closing the loop and how this method will provide better, more reliable care for your patients. So I'll be sending out an invitation for that next week, but feel free to register on our website now if you feel so inclined. Okay, so back to the webinar at 5984 Upgrade. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Cindy Kincaid is Vice President of Client Solutions, and Lindsay Lanning is our Healthcare Compliance Consultant at iTenif. Also, Rob Rizzo, Senior Product Specialist, and Lexi DePasquale, Consultant at iTenif, will be available to help with questions at the end. They both worked with several of our clients during the upgrade process, so they're great resources for your questions. So Cindy, the webinar is all yours. Take it away.
All right, thank you. Well, let's get started with 5.9 and 8.4 upgrade experience. We've got some hold music going on, so I apologize for that. So, Chelsea, I'm not sure if someone has put us on hold that's causing the hold music, but okay, I'm hoping. Now, first of all, can everybody hear me? So I would like Chelsea just, let me know if I can be heard.
Hi, Cindy. I can verify. We can hear you.
Okay, great. So let's just go on. Sorry about that, everyone. What a great way to start. I think it's probably just frozen. We're up to a mighty 19 degrees in Columbus, which is where I'm at. So let's talk about the 5.9 8.4 upgrade experience, lessons learned from early adoption. As we move forward to the presentation, I want to talk a little bit about what we did and the experience we had. We participated with one of our largest clients as the beta process, and we went live very early in the beta process, so we had a very great experience. We've also worked with two of our other larger FQHC clients, and they have completed the upgrade several weeks ago, and one of our multi-specialty clients went up as well. So we've had quite a bit of experience in moving this forward. The first and most important thing is that, as everyone on the call knows, I'm sure you realize it's a 5.9 8.4 is a combined release. You must take them together. It was entered into general release on 9/29/17, and if you upgrade to KBM 8.4, you must upgrade to 5.9 at the same time, and vice versa. It's some of the benefits to this. We actually liked it, and we had done this with other groups in the past anyway, who had elected to have one go live with a single downtime, single training, and consolidated testing. Also, this release does meet the necessary regulatory requirements, but it does much, much more. I have to say I'm very excited about this release in conjunction with UD3 and KBM 8.3.11. Both of those were feature-rich in a number of different ways, and we'll talk a little bit about that as we go through the process. So a few combined upgrades frequently asked questions. What are the advantages to a combined release with 5.9 8.4? Well, we already talked about it. Single downtime, one go live. Any workflow design is done in one time, and you only have one time to do all of your testing. And the next question is, am I required to take both 5.9 and 8.4 when I upgrade, since it's a combined release? Unless you are PM only or have a completely custom KBM, you will be required to take both, and NextGen has to approve it. I have heard some inklings that they may be changing that a little bit, but I haven't seen it come through yet, and frankly, we've been very satisfied with the combined release. As we started looking at this, with this upgrade and as any other, we looked at basic upgrade prep. And I want to kind of take you through the things that we do with our clients as well as some of the clients that we've worked with. I've also had some input as we were sending out the announcements from other clients that I'll be talking about as well that did this on their own or have a different experience. But the first thing I would advise is to treat this upgrade like a full implementation. It is a major upgrade, and if you are not on KBM 8311 or UD3 today, you are going to have to consider that because both of those upgrades had some very significant changes in them as well. So you'll need to train on both. So you want to allow time to review release notes and known issues. Understand what known issues will affect your production environment and possible showstoppers. We didn't have any, obviously, because we went forward. However, there are some KIs, and we'll talk about some of them today, and we can also provide some lists in the future. Keep your performance in mind. As most of you know with upgrades, performance can be very, very challenging after an upgrade because it's very difficult to test as not all users are in the test database at the same time. Make sure that you look at all of the environmental requirements and do as much testing in that capacity as possible. Finally, prepare your test environment for upgrade with a recent copy. I would recommend 4 to 6 weeks of the production database. Don't use an old copy or a shrunk down copy because the testing you do, you want to make sure that you have covered everything and that you are testing with current data. And then also on the, as we've got the little insert on the side, we want to ensure your hardware specs are up to date. You want to review your NextGen products compatibility, NextGen, NextGen dashboard, NextGen population health, mobile, EDR. Review third-party software and hardware compatibility. Don't forget about those other interfaces that you have or your telephone call reminders and things that may not necessarily be involved with NextGen but are impacted by a NextGen upgrade. The technical preparation is also really important. So once you've reviewed all the specifications, make sure you complete any required technical upgrades to your environment and your system software. You're going to need to enable SQL CLR on your test SQL server. You want to prepare your environment for technical deployment specialists, a dedicated machine set as a FAT client with access to the internet, FTP site for downloads and test database folders, and the NextGen root folder. So all of these things need to be in place as you move forward. You want to have access to the SQL Server Management Studio. It can be via a remote connection. Access to the NextGen application, preferably using the NextGen admin account. You want to make sure your universal preferences task inside system administration is pointing to the test environment. You want to identify servers and workstations to be used only for test environment. Switching between test and prod on the same machine is not recommended until both are upgraded to the same version, so keep that in mind. And then complete copy of prod to a non-production environment if a copy of prod to a non-production environment is more than 6 weeks old. We talked about that earlier. Rob Rizzo is on the line as we go through this for any questions at the end because obviously he's much more in tune with these type of preparations than I am. But it's very, very critical to the success of the upgrade to make sure that you have achieved your technical preparation. Planning. The next thing that I emphasize a lot, and we have always worked with our clients, is the first thing you want to do is create a project plan for the upgrade. I'm a big fan of project plans. You want to assign an upgrade team to cover the gap analysis, testing, training, and then updating any documentation that may need for your workflow. When you create the project plan, it's essential to making your project a success. We strongly recommend that you create the plan to fit your practice's need before you perform the upgrade in your production environment. And you also want to keep in mind the duration noted on any example timeline that we're going to present is a baseline for completing the upgrade. Your timelines are based on your needs, the size of your practice, what customized templates you have, any customized workflows, interfaces and hardware upgrades. All of these can impact your upgrade timeline, and it's important to consider all of them. So here's an example project plan, and I know that the bullets on here are too small for everyone to look at. We use a product called ViewPath, but you can use Microsoft Project. We also use that from time to time, depending on what our client needs. We have the ability to use Excel, anything that you need, but make sure that when you do this, it's comprehensive. You have your list, you have your resources, you have the days that you're going to be working, you have your dependencies. Dependencies are very important. If this fails, then you have to stop and move back to this. So any advice that I can give you on your project plan, whether you're using a formal project planning software or you're just keeping a task list in Excel, is to really make sure that it is comprehensive and that you have covered and thought of everything. The first thing that we have after we get it installed in a test environment is we conduct a technical gap analysis. And we install the gap analysis tool from NextGen. You run it in the tool. Now this tool will show you your customized templates, any renamed out of the box templates, and template usage percentage. This is really important because you can base this on templates utilized applying the 80-20 rule. So you want to focus testing on templates that are used most often. And also it's a good time when you look at this, some of those historical customizations that you may have made that aren't needed anymore. This is a really good tool that you can use to start looking at that, and maybe you want to consider retiring some of these templates or these modifications fields. And that leads us, once you've done that, you want to move to the functional gap analysis. And in the functional gap analysis, it's really the kind of the same thing as an add-on to the technical gap analysis. You want to ensure time is taken to complete the manual functional gap analysis side-by-side compare. Take your templates, compare them side-by-side, particularly if you're heavily customized. Are you going to keep them? This gap analysis is an assessment to identify differences between the existing workflow in your current environment and the workflow in the newest version. If you're going to retire templates, then what you want to make sure is that you want to update your workflow. You want to make sure that you're showing it and you're looking at things and identifying it so that everyone understands the impact if you do retire it. This can be completed for EHR 5.8 UD3 and KBM 8.3.11. So if you're not on these versions, you're going to receive updates from these versions as part of the 5.9.8.4 upgrade. It's really important to keep that in mind because, as I mentioned earlier, these were feature-rich upgrades, and a lot of our clients are not on either of these yet. So when you go to 5.9.8.4, you are going to get all of the features encompassed in that were in UD3 and 8.3.11. A lot of the documentation you receive from NextGen are separate documentation, so you have to consider that you will be getting those functionality. You want to take the time to pinpoint your must-have customized templates during the phase. As I mentioned earlier, let's make sure that if you have to have these, this is where you identify them, and then you need to put them in. You also need to determine if there are new template customizations that you can sunset due to the new content in the KBM. Maybe you can get rid of some of them. Maybe some of the must-haves can be moved. And all of those things have to be taken place and are part of what we call the functional gap analysis. Once you've conducted that, then you will move into the workflow analysis. So you want to understand the patient life cycle of your practice as part of this. Break down the processes to identify and evaluate your workflows. This starts with appointment scheduling, moves to reception, your provider processes, your billing post-visit, and routine reporting needs. Again, keep in mind, this is a combined upgrade, so not only is your KBM going to be affected and your EHR, it's also impacting your PM processes and your billing processes. So the entire practice is affected by this. And with the changes that are in here and the fact that you may be considering retiring customization, you're going to want to document your patient life cycle start to finish to know what your staff actually does versus what they say they do within NextGen. We find that to be very important and sometimes telling when you're looking through things because you know what you know and you do it every day and so many things are done out of habit and you've dropped into routines. Well, this is a good time to actually revisit all of that and understand how you may use the new functionality in NextGen as well as any new templates to the better routine of your practice. Now, again, because it's a combined upgrade, we want to consider some things unique to KBM. As we've already mentioned, review all customizations, determine whether to continue or retire. NextGen is going more and more to a more configuration-based of an environment, and if you're going to be retiring templates, it's always good to take this opportunity to look at them. If you are going to keep those, and you need to recreate those in the new environment, be sure in your timeline to allow the time for development and testing for those items that you determine need to be recreated. Provide training and workflow changes for those to be retired. So if you're going to retire them, you have to train individuals, okay, this is no longer here, it's now here. And one thing that sometimes isn't considered is you want to also make sure that you map the data from any custom fields to current fields that are going to be retired. You know, they don't disappear, but sometimes if you delete a field or something, you will no longer be able to see that, and the data must be mapped, particularly if you were using custom fields as opposed to just custom templates and NextGen fields on those same templates. So consider all of that when you're looking into this upgrade and when you're taking into consideration the KVM. Finally, once you're ready and you're prepared to test, review past encounters for custom and map templates to ensure the data is pulling correctly. I've been involved in upgrades in years past where there was new changes to the KVM. Everyone says, oh, we don't need this anymore. But again, very critical data wasn't mapped, and therefore they couldn't see it. And the historical data looks very, very different than what individuals had expected because the testing was incomplete. That goes back to making sure you have a current copy of your database, so you're seeing patients that are very real, and also that you test sufficiently and the number of various scenarios to make sure that you've covered everything. And that leads us right into testing. Rigorous testing is used to identify problems early on and remedy them before go live. I cannot emphasize enough, test, test, test. Testing is always ongoing. Allow yourself time to completely and thoroughly test the application, and not just the functionality of the features that are in the upgrade itself. Again, keep in mind, depending upon where you're coming from, you may have so many different levels of upgrade included in this that you have to look at various levels of release notes. In addition, though, we've all been part of NextGen upgrades where you put something in or you get a hot fix and it fixes this, but it breaks this. Make sure you test beyond just what is on the NextGen test plans, and they are excellent. They really went over and above with regard to this particular upgrade. But make sure that you have all of these things considered and everything considered as you're moving forward. Cannot be underestimated, and it's critical to the overall success of the upgrade. If you don't test, you're likely to miss things, and then things that are missed really gives everyone a negative impression of the upgrade, and it's hard to get that back. If things go poorly on go live, it's really hard to make that up after, even when you've corrected it very quickly. Document using current workflow with the new templates and functionality to ensure that current workflow works in the new environment. Test all your workflows, including custom templates, new and old. Generate all documents that are used in workflows. Documents are often overlooked. They're often overlooked, and those changes with this upgrade as well, so you want to make sure that that's considered when you're moving through the process. So here's an example test plan that we use internally, and what you can see here is that we have the date, who the testing was assigned to, who was responsible for testing that, which program did it involve, and what is the task. And we have it in 3 different environments depending upon what your methodology is. This could be dropped down to 2, but we have testing dates for development database, the test database, and the production database. The date that it was completed and who completed it. And then you want to indicate if it was a success or fail, and you can put that in your comments. But basically, the reason we have the development is if you are creating customization, you're going to have your development database. You might have your test database, which is where your end-user testing and training is going on, and then you have your production database, which obviously that would be the final column that you would check on the weekend of go live, which we'll talk about a little bit later in the process. But you want to have those side by side because I can tell you many times we have had a test upgrade that has gone swimmingly. We put it in production and we experienced things that did not happen when we tested it in the test environment. So make sure you test the same things on that go live weekend and allow time for that in your downtime plan as well. So after you've tested and you basically identify the changes now with training, and you will train the new enhancements and any changes that will impact current workflow, consider all your staff. You've got this all down. So now you want to consider everyone, clinical, physicians, nurses, MAs, your super users, front office, and don't forget about the billing staff. they're going to be impacted by this dramatically, and things are going to be changing for them. So make sure that everyone is considered when you're creating any training and new enhancements and workflow modifications. Update all of your internal training guides. That's also very important, because you've got a lot of things you build over the years, and a lot of times the changes are minor. This one's pretty significant, particularly considering where you're coming from. If you're already on UD3 and KBMA 311, some of the changes will not be as impactful for you as they are for others. But for this particular upgrade, and what I'm seeing with most users, they're not all that far up. So you've got a lot of changes that you want to consider, and make sure you factor that in when you're creating your training guide. So when we move on to training, consider your training options when you're developing your training plan. Are you going to train one-on-one? Are you going to conduct classroom training? What about webinars and recordings? We've had some really, really successful training sessions that we've created with webinars that people could play over and over again. And we've also created some small recordings that are 2 to 5 minutes that people can play and your users can look at their convenience, and we keep them 2 to 5 minutes, particularly engaging for the physicians, which leads me to the next bullet. You want to engage your physicians. Get them excited about this upgrade. There are things in here that actually help them. We have had physicians comment that this is a positive upgrade, that they're happy with the functionality and some of the changes that have been made in here. And you don't hear that very often. And that's not to say they're going to be dancing around the hall saying that they love their EMR. We know that's not going to happen probably in our lifetime. But I can tell you that they are more happy with the functionality in this upgrade, because there's more than just regulatory. And that's important to keep in mind. Training tips in terms of how we have gone through this. The amount and type of training your practice will require depends on your current version and customization. If you're coming from a version of the core product or KBM below the most recent versions, which we've talked about quite a bit during the process today, your training time will increase because the releases are cumulative. If you have customizations, it should be noted you will need to develop your own testing and training plans for these custom templates and documents. What NextGen has online, again, is excellent. They've gone a lot further than I would say 2 years ago in some of the past upgrades. It's really very, very helpful. However, if you're custom or you've got custom workflows, that's not going to be covered, because their documentation is specific to the general public. You need to make it your own. So now we move on to upgrade weekend preparation. We've already talked about how you get here. You've went through everything. You're moving forward. You're really excited about it, and we're ready for the go live. So the first thing we want to talk about is test run your upgrade weekend. Time it out. When you run your test environment, even if you had some challenges or everything, you may want to run it again so that you have an idea of how long this is going to take. Create a checklist and plan for the upgrade weekend. Create a step-by-step timeline. Communicate your downtime at least 2 weeks in advance to all impacted. Everyone who's impacted, let them know how long they're going to be down. Distribute the downtime strategy and develop your rollback plan. I have to say, we have not had to roll back any client during this process, or frankly, several upgrades. I can't remember the last time we had a rollback, because the testing was, should be sufficient that you will know if that's going to impact before you even move to go forward. But things happen. There could be power outages, there could be some type of storm, there could be a lot of things. So make sure you have a rollback plan. Now, to me, the timeline is one of the most important things that you have on a weekend, and this is an example of the timeline that we have created for actual upgrades in the past. So basically what you'll see is it says, we start out that the upgrade is starting. We put in the start and stop time. We take it through the estimated time of how long it's going to take, so you'll see the number of times. And the timeline literally goes through item by item so that you can tell if you're running on track or off track. In addition, when you talk about this and we look at how we're going to do this, we have a notification process you'll put in. So we'll talk a little bit about this. But the first thing that you want to do is you want to start, in some cases users will have a hotline that they call to let people know they're on track. We've had great success with an email chain that whomever is responsible for a certain task or the upgrade will reply all when that is completed and it moves on. So let's talk about some of the high-level upgrade weekend tasks that you will need to do. First of all, you want to put your system into maintenance mode. You want to stop or disable any program connected to the database. You want to disable all SQL agent jobs. You want to back up your environment. Then you run your 5984 upgrade and associated patches. You want to upgrade all NextGen applications, including Rosetta and comm services. And this is one of the things that was pointed out to me by one of the users that were registering for this. Stacey Curry, the Director of Clinical Quality Management at Coastal Family Healthcare, wanted to emphasize this and some other functionalities. Make sure that you remember everything. Rosetta gets overlooked a lot. You don't really think about it. It's hard to test, because you can't really test your lab interfaces and those type of things. So it gets overlooked a lot, and then on Go Live, you've got a real problem. So make sure you keep that in mind. And again, I want to thank Stacey for joining us. She sent a really nice email about some things that they had, because they just upgraded a couple of weeks ago, and pointed out these and some of the other things that we've been talking about throughout. You want to run your weekly maintenance before testing starts. Now, some of these, this can take some time, so you want to factor that in and have some ideas of how long that's taken. Then you send out that email we were talking about, notifying the testing team to begin. You want to execute the test plan, just as we showed earlier. You want to test everything, not just the items with the upgrade, and don't assume that just because it passed when you were in the test environment that it's going to pass in production. Test it again. Then have your scheduled go, no-go call. If there's no-go, you're going to execute restoration of the environment, so your rollback plan. If it's a go, which it's likely going to be, then you're going to enable all the programs connected to the database to back on status, and then you'll move forward and let your users know that you're ready to go. Once that's happened, and again, that was a very high-level list of the items that we looked at, but now you want to be prepared for post-go live. What's your plan for your Go Live support for the first 3 days? Are you going to have a call-in desk helpline? Depending on your size, how are you going to do it? Are you going to have on-site support? Are you going to have people at every location helping them through the process and being able to answer any questions? We recommend you have quick guides available at every site and every station. And also, I'm a real big fan of having a super user at each site, someone who has really embraced the upgrade that can actually assist and help those on-site being able with the day-to-day things that they will certainly encounter. And finally, even though it's not on the slide, be prepared for the things you missed, because no matter how good you do it, there will be something you missed. And that's something that I always try to just really focus on and make sure everyone stays calm, have little things in line that you can give to the users and the staff and to keep everybody happy and calm, because what their impression is on this particular first few days of the new version is what's going to be with them for a long time. So do your very, very best to make sure you've covered everything, and recognize, though, that you won't, and set the expectation. So now we're going to take a little bit of time to go through some of the EHR PM new feature considerations, and I'm going to turn this over to Lindsay Lanning, and she's going to take us through this particular section of the presentation.
All right, thank you. Now, I'm honestly just here to give Cindy a quick break from speaking. She really is the NextGen expert on this upgrade. But let's go ahead and identify some new features with the 5984 upgrade and some considerations you will need to make when using them. These are really just the extra steps involved with the new features to make sure they actually function correctly, and hopefully provide you with some supplemental information on what to look for pre and post upgrade that NextGen may not have told you about directly. So let's start with the EHR. First off, there is a new feature that provides users the ability to snooze alerts or delay the display of alerts for a specified duration. So that's 24 hours, 48 hours, or 72 hours. Now, what the user must realize is that this feature is a security right in system admin that can be turned on and off. It does default as yes or on for all users upon upgrade. What this means is if you don't want your staff to have this ability and you want them to see these alerts every time they open the patient's chart, you will need to go in manually and turn it off by navigating to system admin, security rights, operations, and then EHR patient alerts. Next, something new in the medications module is the requirement to prescribe oral liquid medications in milliliters. If the user does not use the correct units, the system will actually now alert you that an inappropriate unit of measurement is being used, and that's the screenshot you're seeing on the slide right there. So because of this requirement, prescriptions for oral liquid medications cannot be printed, faxed, or e-prescribed if the wrong unit is used. First Data Bank will automatically use the standard unit of measurement, which means you need to make sure your medication database is up to date. Now, the major consideration here is that this change means you will have to manually update any existing medication favorites, active oral medication orders, and user-defined medications to comply with the new unit standard. Another feature added to the medications module is the Exfil Status. This enables fill status of e-prescribed medications to be viewed in the medication module. So participating pharmacies can now send medication fill information back to the provider, and it will be viewable from the Exfil Status column in the medication module. Now, a few considerations to keep in mind here are that both the provider and pharmacy have to be enrolled in the service through SureScripts for this to work. So just because a pharmacy participates in SureScripts does not guarantee participation in this Exfil. They could still show a not participating status. It is recommended to run the pharmacy download update to ensure you have the most recent data. So name change, an address change, or if a new pharmacy has been added is included. We saw from the screenshot, these statuses are visible in that Exfil column. However, you will need to add that column in grid preferences for each user. It doesn't automatically show up. Moving on to the allergies module, specifically the updated reaction section, users will now associate severity to each reaction instead of the allergy as a whole. The new Add Reaction Severity window allows you to define the allergy reaction and the severity of that reaction. So that separate severity field has been removed from the module. So I think we're well aware there are two ways the user can add allergies, through the KBM template or allergy module. When adding allergies using a KBM template, the user will use the same allergy reaction pick list as the module. That list of reactions is actually managed in file maintenance. However, with the upgrade, when a user modifies the list in file maintenance, it will not show in the allergy module, though it would display in the reaction list on the allergy section on the KBM template. So essentially, any modifications made to the allergy reactions list in file maintenance will display only in the KBM template, not the allergy module pick list. This is still a known issue that's in progress. We provided you with that KI number. We just wanted to make sure you all were aware of it since we've had clients experience this. Users now have the ability to document comorbid conditions through the comorbid condition checkbox. This added checkbox will actually mark individual problems as comorbid. However, this column needs to be added in grid preferences for each user to see this. Again, it won't automatically show up. And lastly, on the EHR side of things is a consideration for the orders module regarding credentialed staff. NextGen has replaced the single credentialed checkbox with separate checkboxes for medications, laboratory, and diagnostic. Existing users will default with all three checked, which means if you need to uncheck individual boxes for each user, if they shouldn't have that designation for some reason, you'll have to actually go in and manually do that. This really just gives you the added ability to be more specific with credentials. Do keep in mind, though, it will actually affect your CPOE measures for Medicaid meaningful use. And then moving on to the PM features and considerations here. There is a new feature within the appointment book, which allows users to see EHR follow-ups in the appointment window in PM. Follow-ups entered in the EHR will actually be visible on that Recall Waitlist tab. That blue pushpin icon lets users know there is a follow-up order. Previously, when a provider entered a follow-up order in the EHR, you couldn't see it in PM. Now you can. Before, you would have to send a task, or you would have to have a patient tell the front desk staff, which isn't always reliable. Now, when users schedule a follow-up appointment, they would go into the Recall tab and see the order right there. The user would then schedule the follow-up visit based on the order. Once the appointment was scheduled, they can actually right-click on the follow-up order and auto-update the order in EHR with the appointment information. So this is effectively closing the loop on the order and letting the clinical staff know the appointment has been made. Now, this is a great new feature. A lot of our clients are really excited about this functionality. However, there is a consideration to keep in mind. The follow-up appointment in PM has to be saved before the update KBM with PM appointment date can be selected. And after updating the appointment in PM, there's no confirmation. The appointment window has to be refreshed to see the change. So you can do this by either closing and reopening the appointment window or going to a different tab. Either one will work. And our last new feature and consideration topic involved the addition of Shoji Fields. Shoji stands for Sexual Orientation, Gender Identity, and new fields were added to the Demographics tab on the Patient Information window. So on that Modify Patient Information pop-up, you can now select birth sex, which was changed from sex, current gender, which is new, gender identity, sexual orientation, and preferred pronoun, which are all also new as well. Now, a consideration for these new fields is that if a user navigates to Enterprise Preferences, Client Defined, they can actually make all Shoji fields required. Decide if you would like each Shoji field to appear on either the General tab or the UDS tab. And you can even privatize gender details by making it a link on the General tab. I will say the default upon upgrading is to display the Shoji fields on the General tab. So if you would like to change this, these extra steps are required in Enterprise Preferences. All right, looks like we've made it through the new feature consideration section. I am going to go ahead and hand it back over to Cindy to take us through our final section of lessons learned.
Okay, thank you, Lindsay. All right, first of all, as we go through lessons learned, the one thing that I, again, want to emphasize is that we went through the features and functionality that are in 5.9, 8.4, and there's some of our favorites. There are more that was certainly not all encompassing, and we did not cover UD3 and KBMA 3.11, and it's very, very feature rich. So if you're not on that, you want to consider both. So as we move through lessons learned, we were a beta site, so some of those we took out that were corrected. Being a beta always gives us the opportunity to see everything from the ground up as to how they're correcting the items, and I have to say NextGen has done an amazing job compared to others. But there are things that still have to be considered, and we want to take you through those now. First of all, the transaction log. Now, they have made some improvements to this. Initially, there was no warning about this, but as a pre-upgrade consideration to help with the transaction log growth and protect against running out of space, users should be aware to put the database in bulk log recovery mode. Rob can answer more questions about that, but I cannot tell you the first couple of times we ran out of space because of the growth that happened in the transaction log, so make sure that this is covered. Now, this only works for non-mirrored environments. So keep that in mind as well. If you have a mirrored environment, you're going to have to consider the disk space that will be created by the transaction log growth. Also, 5.0 EDR clients. If you are on 5.0 EDR, and we have many FQ8Cs, there was nothing in the release notes about this, but you have to be on 5.0 UD1 patch 2 before you upgrade to 5.9.8.4. That's crucial pre-upgrade consideration. And you don't really see it in testing. We found this out, not necessarily the hard way. We did find out before go live, but it was a little bit of a surprise to everybody that we had to add this additional upgrade. So make sure you have that in your plan. Rosetta. Mentioned it earlier. We're going to make sure it again. Make sure that Rosetta is up to date with the upgrade. This should be part of the upgrade process, but it sometimes still gets missed. Again, likely because you don't really test it that much because of the fact that it's typically your interfaces, but make sure you add this to your checklist. It's very, very critical. Social Security number masking. After upgrading to 5.9, the new setting, Unmasked Social Security and System Admin, is defaulted to yes instead of no for all security groups, causing the Social Security number to be visible for all users in PM. This is even if the practice preferences is set to only display the last 4 of the Social Security number. We got caught on that one, so that's one to make sure that you set this as soon as you have the system upgraded. And the way you do that is to resolve this, the users would need to go into System Admin, Operations General, and unmask Social Security number. Pharmacy updates. Currently, users are finding that pharmacies entered in the new PM Pharmacies tab will not display in the EHR information bar or the EHR demographic screen. That was disappointing. We actually did discover this in testing, but what that means is that everyone was really excited about the fact that you could now add pharmacies in PM. That's great, but you can't see them in these two spots, the patient information bar or the EHR demographics. They only show in the medication module. So I've had some of the groups elect not to use this functionality until that is changed. I don't have a date that is going to be changed at this point, but that is the way it functions today. I believe it will be changed in the future. And again, some use it, some don't, but just be aware of that. The tobacco historical use. Tobacco historical use grid is displaying usage per day as packs instead of cigarettes. In order to correct this issue, the user must manually update the history. That's not something you can run with a script or anything. You have to actually go in and correct that. Tobacco cessation. Clients are finding the tobacco cessation discussed checkbox is automatically checked and won't allow to save this tobacco cessation. Now, this is one that we encountered and is still an issue, but we felt it was important enough to mention because we've encountered it on every one that we've had at varying degrees. The medication module performance has had an issue with this particular upgrade, and what you may experience is slowness with the medication module when launching or accepting new medications. If users or physicians report the slowness in the medication module after the upgrade, there is an index fix for this. You can reach out to NextGen and they will assist you with it, or if it's something we're working with you on, if it's one of our direct clients or one of the clients that we're consulting with, we will certainly make sure this is addressed. But there is an index fix, and it is listed as a known issue. Prenatal details template. Under the prenatal visits panel on a previously locked encounter, users are not able to see comments. The workaround is to unlock the encounter or click the progress note summary button on the prenatal detail and utilize the pregnum correction tool. We've had a lot of issues, and for those of you who deal with the prenatal details or pregnum issues knows that this has kind of been an ongoing thing with NextGen. So there are some scripts and other things you can use to help perhaps identify, but it doesn't correct. The only way to correct is to utilize the pregnum correction tool. PM memorized reports. As with many upgrades that I've experienced, but this one was particularly impactful, make sure you run all of your PM memorized reports to ensure they still run as designed. And you may need to reconfigure or rebuild them. Once you do that, they're fine, but we get those typical errors, particularly because there's so many additional items that have been added to this upgrade. On the charge entry screen, in an earlier version of 5.9, on the charge entry screen in PM, 12 diagnosis codes were allowed to display. They have decreased this down to 4 diagnosis codes in this version. However, 12 diagnosis codes are still allowed to go out on a claim in box 21 on a CMS 1500 and 25 on a UB04. So visually, they've reduced it, but 12 is still allowed from the claims perspective. While there are a number of other lessons learned and known issues, these are just some of the ones we believe were worth highlighting. I want to make it that point. NextGen has a complete list on the success community. We also have developed a list through the upgrades we've done, and we're continually adding and appending that with known issues and the version that was discovered in. Because what you will find is many of the known issues that we encountered were actually known issues in, say, UD3 or KBM 8311, but because so many people didn't use those versions, those known issues were not fixed in 5.9 and 8.4. So we've developed a pretty comprehensive list, and we've also developed a list that I think will explain what the impact is. Also, again, as I mentioned, Coastal Family Health Center upgraded a couple of weeks ago, and Stacy was very gracious to put in some of the things that they had learned. And she talked about macros and other items that I think are covered somewhat in the testing, but be sure when you go to your testing to understand that all of these things are parts of your lessons learned. And I think you can cover and address a lot of things by making sure you have your test list, your checklist, your project plan, your timeline, and just general planning, and make sure you follow it and allow yourself time and have the diligence to understand the impact of this upgrade, because it is a big one, but I will tell you it's one that's definitely worth taking. When you get yourself current with this release of NextGen, you're going to find the functionality that they're putting in is a lot of things we've been asking for. We didn't really touch on the features. That was a different webinar, but there are a lot of really positive highlights to these upgrades, and I really hope that you move forward with them and find them as impactful as we have. So if you're uncertain where your practice stands, let's let iTenif help by assessing your current readiness. We can provide recommendations, and we can do the implementation of new processes and procedures. And this might be a good time to take a look at that as you move into these new areas of the upgrades and functionality. Next steps, you can visit us at itenif.com. You can sign up for our webinars and blogs, which all of you are on the webinar, so you're obviously signed up. You can consider one of our 3-day fixed price on-site consultations for clinical workflows, revenue cycle, and front office technology and performance. And then you can test drive our products, Refund Manager, ChartGuard, and any of the other items in scripting that we've been able to add to enhance the functionality of NextGen. And now I'm going to turn it back over to Chelsea so that she can handle the questions, and we can move forward with your questions and answers about this upgrade. We've got about 12 minutes.
Great, thank you so much, Cindy, and thank you everybody who's still with us. We've received a number of questions from people since the beginning of it, but we're just going to go through them all in the order that we received them. I'm sure that we're going to be able to get to them all, so if you have more questions, please feel free to ask. Okay, first one. Are you saying that all custom templates have to be created in the 5.9 environment?
I can take this one. No, I'm not saying that. What I am saying, though, is if you have, let's say you have a custom template and it is something that you're using as an intake, and there is a new functionality on the intake in the new version, and you want to utilize that new functionality, you are going to have to either recreate your customization on the intake, or you're going to have to move that customization there. If it's a totally separate independent template with totally separate fields, then no, you shouldn't have to recreate it, but just make sure you test it.
Great, thank you, Cindy. Next question. Are you going to provide detail about any incidents you encountered during your upgrade once they went live?
I think we probably covered that somewhat in the lessons learned. Really, the testing was pretty impactful. We had some incidents that I won't get into that were corrected during the beta process. So we had some real nightmares on when we went live on the beta version to the point of not balancing and everything, but we understand that going in with beta. The biggest issues that we had was the performance associated with the medication module. That was unexpected. We did highlight some of the little things with security. We had some other security issues that with one of our clients that had to do with the inability to post charges, but NextGen corrected that again. They paid very, very close attention to the results their beta clients have. And then there's the known issues that were discovered as part of the testing, and a list can be provided. None of them were rollbacks, but again, pay attention to your performance, pay attention to your testing, and then take a look at the items we had at the webinar to considerations that maybe weren't documented as clearly or we didn't understand.
Great, thank you, Cindy. Another question. If we're not on UD3 or 8331.11, should we go through those release notes as well as the 5.9.8.4 release notes?
Yes, and any other versions you're not on, but definitely, because I can tell you from a PM perspective, there's a lot more in 5.9, but the bigger impact in the KBM was in KBM 8.3.11. There's more and there's augments, but definitely if you're not on those, make sure you understand them and that you're prepared to train on them.
Great, thanks, Cindy. Got a couple of questions. Will the slide deck be sent out? Yes, we will be happy to send out the slide deck within the next week. I'm going to be sending out an email with a link to the recording as well in case you want to share that or review it again, so keep your eyes out for that. Next question. Any experiences with the new spell check feature slowness on templates?
We actually talked about that, and there was some challenges when we first had it in beta, but we've been pretty successful with that since then. I actually talked about putting that in there, and our perception was that it was corrected. Rob, I know you're online. Was there any index changes to that? Because we did experience that in beta, but we have not been experiencing it, and I can tell you the users love it. So I don't know if there was something we did or if it was just NextGen corrected that.
NextGen corrected UD6 to UD8 when we're going through the beta process. Can you hear me?
Yes, heard you. Thank you, Rob.
Okay. Thank you, Rob. Next question. Would you please share your list of known issues with us?
Yes, we're happy to. And again, keep in mind, this is our list. I would not recommend that you replace this by, you not look at NextGen's list. We do try to compare the two, and we also have taken off some that are things that our clients have said, well, we would really like this, but NextGen has it as functions as designed. We've kind of made some notes on that, so we may have some things on that NextGen doesn't classify as a known issue, but we're happy to share it.
Great, thank you, Cindy. Can you talk a bit about your approach to patch releases?
Well, NextGen has changed that a little bit, so I'm going to probably turn this over to Rob. We typically will put patches on when, depending upon what it is correcting and if it is something that is impactful to the client. For example, if there's something with the, I'm going to just throw this out of thin air because it's really not probably accurate, but it'll give the idea. If it's something specific to, say, a UDS reporting tool or something, then we'll put it on the people who are doing UDS reporting, but maybe others don't have a need for that. That's typically been our philosophy, but NextGen is doing a little differently because they're putting them out in a more timed way, and they're looking to be more deliberate about these than they were in the past, and they're not coming out with the frequency. Rob, can you share anything on that?
Yeah, each patch has its own release notes also. So what we've done in the past, when we upgrade, their test environment, we'll disclose the release notes to see if these are any issues that will be impacting the client, especially in the 8.4 patches. They're really template specific. But any patch that you stick in after going, after 5.9 is in production, you definitely want to test because they are cumulative. Meaning if you put patch 3 in, you're going to get 2 and 1 prior if you didn't take any patches when you went to production. Does that help?
Yes. Thank you, Rob.
Okay. Were there any features of note in PM for 5.9?
Well, let's see. There was the Shoji. Okay, one that I have, and without having it up here, and because I sometimes blend UD3 and 5.9, but one of the ones that I loved completely, which is such a silly little feature from some people's perspective, is you can now, instead of having to go out and look at the date and know the date, you can do like 1 month, 2 weeks. So in a lot of the date searches, you have the ability to do it based on time. So if you're doing a recall and then they say they want to see you back in 2 weeks, you used to have to calculate that. The Shoji was big. Lindsay, we both put that webinar together, and I'm trying to fill it. Do you remember any, from a PM perspective, the reports? Depending on your version, you can do snapshots. There's a lot of things you can do from a reporting perspective. Those were greatly enhanced.
Yeah, I think one of the main ones that we had talked about was, we mentioned this webinar too, was the ability to close that loop with the PM side, and having from the PM side be able to show that the appointment was scheduled for a follow-up appointment in the EHR, as well as that quick advance you talked about on the calendar for scheduling an appointment.
We did a webinar on the features and functionality that's a little more comprehensive than what we covered in this one, because this was a different focus. If you want to visit our website, that webinar is out there, so you can actually take a look at that and see some of the more, concise ways that we did that. Once again, though, that particular webinar was for 5.9.8.4. We have one that's older and historical for UD3 that you might also want to take a look at if you're not on that version. But there's a lot of functionality in those two releases, but PM's been neglected for a while. So there was a lot of things in there that we're really excited about.
And if you have trouble finding those old webinars, just feel free to reply back to the email when I send that out with a link to the recording, and I'd be happy to send you direct links to find those previous webinars if they'd be of interest to you. Okay, next question. And it looks like this may be our last question, so if you're sitting on any, feel free to ask. Did the 5.9 upgrade impact HQM and data collection for meaningful use?
I don't think it impacted it, but Lindsay, why don't you speak to that? Because I know that particularly you've been excited about some of those changes to H2M recently. So I'm going to give this one to Lindsay. This is her baby.
I have to laugh that I still was able to slip in a meaningful use reference in my little slide deck today that I had. So obviously there was a change with the 3 check marks that were included for the credentialing. There's now a medication, a diagnostic, and laboratory. For instance, if you unchecked those would not pull correctly for your CPOE measures for the meaningful use things. There are some things, I mean, 5.9.8.4 did have a large impact on the regulatory reporting aspects of it. We now have the H2M visible on the EHR side of things. You're able to pull down that information from the patient information bar. Based on the collecting of data, some things that really stood out to me were when you are now sending a message to the portal, you need to have a checkbox check that says this is clinically significant in order for it to increment your numerator. So there are some changes here with how the H2M is going to pull your data and how you're actually going to increment your numerators for your measures. We did cover a good amount of those in our features and functionality webinar we did a few weeks ago. There is a section at the end that's really just focused on the advancing care information and Medicaid meaningful use updates in this upgrade. So I will go ahead and direct you guys to that PDF as well.
Great, thank you, Lindsay. It looks like we have another question. Are there any upgrades to the optical management? Sorry, are there any upgrades to optical management?
No, I know there was some. I know that there were upgrades from a template perspective and everything in KBM 8.3.11, but I do not believe so. Although I don't want to be all-encompassing, I would have to look. So we'll have to get back to you on that. We'll take a look and get back to you on that. I'm not aware of that, but I'm not, again, since I haven't upgraded any of, we haven't upgraded any of our ophthalmology clients yet. I haven't dug that deep, so I'll be honest. I do know there's template changes to the knowledge base for ophthalmology.
Okay, great. We'll follow up with you a couple days after this webinar with an answer for sure. Well, it looks like that might be all the questions. So thank you everybody for joining us. You can see Lindsay's and Cindy's information up on the screen. If you have any questions that occur to you later, feel free to reach out to them. Or again, you can reply back to my email when I email out a link to the recording and the PDF of these slides. Basically, any way you can get a hold of us, we're happy to help, and hope that this helped shine some light on this topic. And we look forward to seeing you at our next one. Happy New Year, everyone, and thank you for joining us.
Thank you, everybody. Have a great day. Stay warm.